I'm Missy at Insight Rehab and Wellness in Bethel, Connecticut. Today's Insight of the Week, we're going to talk about lateral epicondylitis, or what's commonly called tennis elbow. Tennis elbow is an overuse injury of your extensor tendons in your forearm. It's usually caused by repetitive strain, either repetitive gripping, or wrist extension, like in the backhand in tennis, or repetitive supination. Supination is when your hand moves from the palm down position to the palm up position. So you might supinate repetitively when you're tightening a screw with the screwdriver. Okay, despite being called tennis elbow, only about 10% of people who have lateral epicondylitis play tennis. You're more likely to get tennis elbow if you're over 40 years old, if you are obese, a smoker, someone who engages in 2 or more hours of repetitive activities that would strain this tendon a day, perhaps for their job, or an athlete who does a particularly intense or prolonged workout. The overuse injury causes degenerative changes to the tendon, micro ruptures of the fibers, collagen disorganization, and a thickening of the tendon. You can elicit the pain in a very exquisitely tender spot right below the lateral epicondyle of the humerus in the area of your elbow. And you'll feel that pain when you extend your arm all the way out, extend your wrist up, and just resist some wrist extension. And then you'll feel that. You can also straighten out your hand and extend up your middle finger and give that some resistance down. You will definitely feel it then. Okay, the treatment for tennis elbow would be to rest from the offending activity, to use ice on the area, 15 to 20 minutes of ice 3 times a day, or after you engage in repetitive activity that irritates that area. Another thing you need to do is stretch. So you would hold your arm out straight, flex your wrist, give yourself a little overpressure and deflection, and hold just gently, about 20 seconds. Relax, shake it out a little bit, and again, extend your arm out, flex your wrist, give a little overpressure for about 20 seconds, and relax, shake it out, and again, 3 times a day. For exercise, you want to use an eccentric contraction. Okay, that means you're going to put your arm on a table. The concentric contraction would be bringing my wrist up here into extension. Eccentric would be lowering it back down into flexion. Okay, so I'm going to help it up into the concentric, and I'm going to release it and lower it into eccentric. Okay, so I'm going to help it up, and then I'm going to give myself a little resistance, not a lot, just a little resistance as I lower my wrist back down. I'm going to help my wrist up into extension, give myself a little resistance, and lower slowly. And again, bring it up and lower slowly. Bring it up, little resistance, lower slowly. Okay, you can do that 15 times, 2 sets, 3 times a day. If you don't want to provide your own resistance, you can use a water bottle, can of soup, or a lightweight. And again, you're going to help your wrist up into extension. You're going to lower slowly, probably a count of 4, 1, 2, 3, 4. Bring it up and lower, 1, 2, 3, 4. Help it up and lower slowly, 1, 2, 3, 4. Okay, again, that's 2 sets of 15, 3 times a day. You may want to ice afterwards. A lot of people have good success with counterforce straps. You can buy those at a drugstore, you're going to put the strap about 2 finger lengths below that most exquisite tender point. Okay, and put that strap on, tighten it down pretty tight, and that's going to help relieve some of the pain. It also helps spread the tension that comes through the tendon, helps spread that tension out across your forearm better, so it doesn't just strain the fibers that are already irritated. Okay, good luck with your tennis elbow. Thanks.